I think it's important for people to understand that mental health is so interconnected with drug and alcohol use, and that it's not a shameful thing to have.
And I don't think that it's always possible or even necessary to separate out what is mental health, what is drug use. I think it's more important to see an individual as a whole and to provide holistic care that takes into account any mental health issues that they might be experiencing, as well as any AOD, so substance issues that they might be experiencing.
A lot of people experience anxiety and depression, and that's why they might use or drink to cover that up. So once they start changing that sort of drinking or drugging behaviour, the anxiety and depression might come through a bit more.
Obviously they're going to impact upon each other. That's not always negative, you know, there can be positive impacts as well. And when it gets to a point where substance issues are impacting negatively on somebody's mental health in a significant way, then that absolutely calls for really sensitive, compassionate and holistic care for that person.
And that's what we work with in counselling or support groups, or even with GPs and doctors, is around managing the mental health side of things and working out where it fits.
Being able to understand what is going on in my mental state while on drugs has been something that I've come to understand after a lot of experience on drugs and on a lot of different types of drugs. And I now feel that no matter what the drug is doing to me, whether it's really good or whether I've taken something that's making me feel a little bit off, I now have enough experience on those drugs to be able to get myself through it in a way that I'm not freaking out, I'm not having a bad time, I'm still able to engage with the people around me, and I know what I need.
So if you are feeling like you want to make some changes to your life and improve your health and well-being, and a component of that is your mental health or your alcohol and drug use, it's totally cool to reach out and get some support. It's okay to talk to people. If you don't have people in your personal life, sometimes it's really hard. Some people might not have a lot of friends or close family that they can rely on to be there for them, but that doesn't mean that you need to go through it alone. Get professional support, and they can link you to other social networks and social peer support groups so that you can meet people who are going through something similar.
And that's what we should all be helping each other do in like drug taking communities such as clubbing communities, etc. We should be able to like talk about that and talk about our experiences and talk about our bad experiences as well.